Health and social care providers in Mid and South Essex have teamed up to develop plans to improve how local people can get the right care they need, when they need it, and in the best place, whether that is at home, in the community, or in hospital. The NHS and local authorities in Mid and South Essex have formed a partnership to make these changes over the next 5 years. Known as the Mid and South Essex Sustainability and Transformation Partnership, this is one of 44 STPs in England. The vision is to unite our different health, care and voluntary services around you and all of your needs, with physical, mental and social care working together. The plans aim to help our services to face challenges and take action to meet the demands of the future. Starting with you and your family, there is more that we can all do to stay healthy and avoid serious illness. At home and in your community, we are building up GP and community services, such as pharmacists, and increasing the range of services available at GP practices, such as nurses, physiotherapists and mental health therapists. Each of our 3 main hospitals in Southend, Chelmsford and Basildon will continue to provide the vast majority of hospital services, including 24-hour A&E at all 3 sites, but working together to provide more specialist care. To secure our local NHS for the future, we have been working to redesign the way we deliver care across a range of highly specialised hospital services. We have identified some areas which we believe will address these challenges over the coming years and want to find out what you think of these plans. Our proposals are based around 5 principles for the future of hospital services. Principle 1. Improvements in A&E. At all 3 hospitals, all 3 A&Es will continue to be led by consultants, open 24 hours and receive blue light ambulances. To improve how we care for patients, we want to introduce 4 new assessment units to support older people, children and those needing urgent medical or surgical treatment. Principle 2. Develop specialist centres for emergency care. For example, a new specialist stroke centre. The new unit will provide the highest dependency and intensive care to the highest standards based on national and international evidence for patients in the first 72 hours following their stroke. Principle 3. Bring together specialist care that requires a stay in hospital. Our proposals aim to bring together some specialist services for the times where once or twice in our lives you might need very specialist emergency care or a planned complex operation. Principle 4. Planned operations separated from emergency cases. Across the 3 hospitals, around 380 patients per day are currently admitted to hospital for a planned operation. By separating planned operations from emergency care, we want to reduce cancellations and rates of infection for planned operations. Principle 5. Moving community services closer to where you live. For example, our proposals outline how services currently provided at Orsett Hospital could also be provided in 4 new integrated medical centres. Through these new proposals, we estimate 15 emergency patients and 14 planned operations per day could transfer to a different hospital for a few days. But the benefit is that a larger team would be able to provide immediate specialist treatment and help you recover quicker. Clinical evidence shows that it would improve care and the chances of making a good recovery. To help support all of these proposals, we will develop a new clinical transfer service for patients who need fast transfer to another hospital. In addition, we are proposing to establish a new transport service to help friends and family visit you whilst in hospital. We want to know your views on these proposals and what these changes could mean to you and your family. We have launched a public consultation to help us discuss the plans with you and our local communities. For full details and to get involved in improving your local health and care services, go to our website nhsmidandsouthessex.co.uk.